Welcome everybody to the Omni Hypnosis Training Center. It's great to see you all again. We were here this morning for our diabetes program, and it's nice to see you've had the courage to come back again. This afternoon, we're going to be covering a subject that is a joy for me to teach and get involved with, which is called the coma state of hypnosis, or the hypnotic coma. Coma is not new. It's been around a long, long time. But if we look back at where everything began, and let's talk about levels of trance for a few minutes. We can look back as far as the Greek and the Roman days, where they used to put the folks in sleep temples, and they really didn't know what to do once they were there, other than just leave them there and see what happens. Well, of course, none of us were there that we can recall, but probably some of those people just naturally dropped into the coma state, as a lot of people will naturally snap into this deeper level of trance. The levels of trance that we really know of today probably started after Mesmer. Again, Mesmer back in the 1800s and really didn't understand levels of trance. It was just a state people went into that was still pretty undefinable back in those days. And we really started getting involved with levels of trance and identifying them pretty much just prior to World War I. And back then the British were probably your main factors involved with that, when you had a group of British corpsmen were working with the soldiers of that period, where trance levels were really becoming more identifiable. Not that they weren't before that, but before that they were pretty crude levels of trance. Let me give you an example. Dr. Bernheim, who we love. Dr. Bernheim was really, to most people's mind in the work, the first person who really gave us a path to find somnambulism by design. And because of him, Dave Ellman refined that to the induction that's so good today in our work for getting somnambulism. But Dr. Bernheim, for example, his levels of trance, and I'm going to quote you out of a book written by Jesse Gordon, edited by Jesse Gordon, called Clinical and Experimental Hypnosis. When they get into some of the levels of trance of some of the earlier people in here, Bernheim basically, in about 1891, broke the levels of trance into two basic levels, but with degrees in between the levels. His two levels were basically memory retained upon emerging from trance. In other words, they would remember what happened. And also after that, a level of trance called the second level would be amnesia upon emerging. They wouldn't remember. So he was basically not remembering and remembering were his two levels of trance. He broke it down further than that. Then it goes to nine levels. The first five are in the memory retained on awakening, and the last few are under the amnesia on awakening. And this is in every book. You can read this. It's really not that important to go into exquisite detail on all these different levels. But Bernheim was probably one of the earliest ones that really would identify that, or try to correlate that the levels of trance were based on something you could touch, see, feel, or taste. For example, first degree, they were drowsy and they were kind of warm. Second degree, they couldn't open their eyes if they were challenged to do so. Third degree, catalepsy suggested by the hypnotist. Fourth degree, catalepsy and rotary automationism. Rotary automationism. Jim, have you done your rotary automationism today?
I forgot.
Yeah, you got to do it every day. Fifth degree, involuntary contractures and analgesia. Sixth degree, automatic obedience. Automatic obedience. There's one. Geez, I'd like to see if I get my wife to do that. Subject behaves like an automation. an automaton. This is strange stuff, isn't it? And then the second level under Bernheim was the 7th degree, amnesia on awakening, no hallucinations. 8th degree, to experience hallucinations during sleep. And 9th degree, the able to experience hallucination during sleep and post-hypnotic abilities. So that's what Bern, but at least he was working toward it, which is pretty cool. Ellman, for all practical purposes, we move forward after Bernheim because the next real break was Dave Ellman in identifying, well, actually, Ellman and another fellow, Harry Aarons, about the same time were developing their own levels, concepts of trance. Ellman had 4 levels of trance. He said there was light hypnosis, medium hypnosis, somnambulism, and hypnosis attached to sleep, which he called the deepest level of all. Well, that was different than the coma state, a lot different than the coma state. Ellman's philosophy was simply the light and medium state had absolutely no value in our work. Now you got to remember the context that he was talking about. There are some very nice things you can do in a medium state of hypnosis, but you're not going to be able to do regression. You're not going to be able to punch suggestion in there with an awesome power where you gain permanency. But Ellman especially said that there's no value to the medium or light state because who was he training? He was training the physician, and the physician had to be able to use the skills and achieve outcome in the same amount of time that he would give to any other patient. And the only way you're going to do that is in deep somnambulism. So he had no use for the higher states. And his philosophy also was, why bother with those other states when you can just blow past them so quickly anyway and get to somnambulism? That is, that's pretty much my philosophy, as most of my students will be willing to attest to. I see little value personally to the light or medium state because I believe in getting right into where you can do any kind of work that you need to do, and that's somnambulism. To move on a little bit further, now a lot of people, especially your licensed professionals, they fall back on something called the Davis-Husband scoring system. The Davis-Husband scoring system. They start out, first of all, before they get into that, by discovering, and I use that in quotes, what a person's hypnotizability is. And what they will do is say, you know, you kind of look up and close your eyes and you know, the better subject you are is the more you can get your eyes rolled up into the top, and the lower you lower your eyelids. And I always found this absolutely amazing. I'd like to know who came up with that doozy. I mean, it's absolutely mind-boggling. But certain people hold on to that as being an absolute valid measure of hypnotizability. Other people say, and one of the primary people who do this is a fellow by the name of Ernest Hilgard. He's a professor. He states hypnotizability is randomly dispersed throughout the general population. That simply means then there is good subjects and bad subjects. Well, we already know that's not true. There's no such thing as a bad subject. But this is the path we take. All there are people who have fear versus people who don't have fear. Fear is the only constricting factor to a person enjoying the deep levels of hypnosis that are available to everyone. The David and Husband susceptibility scoring system has a potential of 30 scores. And you're supposed to rate your patients based on this scoring system, which takes a person from just slight relaxation to break it down to the fluttering of the eyes, the closing of the eyes, complete physical relaxation, catalepsy of the eyes, limb catalepsy, rigid catalepsy, glove anesthesia, partial amnesia, post-hypnotic anesthesia, personality changes, simple post-hypnotic suggestions. This is pretty interesting, isn't it? Kinesthetic delusions and complete amnesia. That's all that leads up to the medium level of trance, then the somnambulistic trance, ability to open your eyes without affecting trance, bizarre. Bizarre? Did I just make up a word? Okay. A complete somnambulism, positive visual hallucination post-hypnotic, positive auditory hallucinations post-hypnotic, systematized post-hypnotic amnesias, negative auditory hallucinations, negative visual hallucinations, and hyper anesthesias. So you can use that scale if you want. It just seems like it would take a little bit long. Hold on a minute, sir. I need to score you here a little bit as you're moving into the session, you see. But it's out there. I mean, everything is out there that you'd ever want to know about trance level and things on that order, and you use what fits you. Today, let's understand levels of trance as they've developed for us in the real world of hypnosis. Not in some scholastic environment of philosophical approaches, but in the real world of the clients who are in your office. There has, and let me back it up again for my students just a little bit. I think it's important to go over it. Basically, there have been two approaches to the levels of trance in our world today. The first one was developed back in the 40s by a fellow by the name of Harry Aarons. Harry Aarons started an organization called the Association to Advanced Ethical Hypnosis. He wrote a book called The New Master Course of Hypnosis, which back in the 40s and early 50s was the state of the art. It was good. By what we know about today, it's just part of our history, or it should be. There's a lot of people still teaching based on that book being the state of the art. And so you'll see it out there a lot. And in there they basically say there's three levels: a light, a medium, and a deep. They also break these down into light hypnosis, light medium, deep medium, stuff like that. So there's about 6 different levels, but it's basically 3 levels: light, medium, and deep. Their philosophy has been and continues to be, on the first session, 20% will go into the light state, 60% into one of the medium states, and 20% into the deep state, called somnambulism. After repeated visits, these numbers really don't change that much according to that program. Now, I've got to tell you, one of the things that upsets me a little bit about our profession is this is still being taught in this country as the way it is. And it's being taught by some rather large organizations that this is the way it is. So those organizations are still working on this old model of the 40s and 50s. Now, what we know about levels of trance today simply flow this way. Yes, we certainly agree there's a light state, and we agree there's a medium state. Light state indicated by closing of the eyes, getting nice snuggled in, and kind of focusing on the hypnotist's voice. Because we don't have time to do a lot of scoring systems, we want to get the work done. We'll just say the medium state is indicated by catalepsy for a small group of muscles through suggestion. Gee, I wonder how the Elman induction starts off. Starts off right away with a catalepsy of the eyes, does eyelids. So there we are, just as quick as we can be using that induction, jump right into the medium state as a starting point. And yes, they say there's the next thing is the deep or the somnambulistic state. One of the pure tests for somnambulism is simply a person will accept a suggestion of amnesia for something through a suggestion of doing that. in the element induction, we suggest they'll relax the numbers out. They do. And if they've done that, well, we have a good state of somnambulism. The next state is the state that we're here to talk about. And that is the coma state. Now, there's something I wish I knew about this state that I don't. I don't know who named it, but I'd like to get the person that did. Because when you talk about the hypnotic coma, it's natural for people you're talking to automatically identify with the medical coma. And the hypnotic coma and the medical coma have very little in common. Very little. But it's a frightening word. The word itself for people is an inhibitory thing for some people allowing themselves to reach this level of trance. So I wish we would have picked a different word. If it was left to me, I would have picked the nice and deep state. I would have thrown the word nice in there because it is nice. Anybody in here ever enjoyed this state? All right. And me. I think that everybody in the world should be able to have this state. Let's talk about it. What is the coma state? What are its values? What are its positives? What are its negatives? What are its limitations? What can it be used for? Well, first, and probably one of the biggest characteristics of the state, is it is a state of absolute pleasure, absolute utopia for the individual. All the person's problems of daily living are gone. All their problems they may be having with their spouse, their kids, their job, the dog that bites them when they come home from work, are gone. Everything is perfect. It is a utopia state where everybody would love to be. When you're in the state, you're not zapped, you're not unconscious, you're aware of everything going on around you. The more you go into the hypnotic state, the more your five senses work better. So your hearing, your eyesight, everything works better the deeper you go into hypnosis. So you're very much aware of the world around you. You just choose not to be a participant in that world, because you don't want anything to do with it. It's a state in which you will not accept any suggestions for behavioral change or anything else. Now, we've learned there's one primary exception to that I'll get into in a little bit. But it's not a state for doing therapy. It's a state for leaving them alone. It is a state which comes complete with a natural, total anesthesia. Now, this has great value. It's a great state if you have to do surgery on people with a knife or a laser. It's a terrific state. Probably when we were down in Fort Lauderdale, and like I mentioned many times in my teachings, one of the things that I really love to do is painless childbirth because of the joy it brings, and it's all positive. We used to have a laminated menu for women. How would you like to have your baby? And they would take a grease pencil and check these different items that we had. The first one was that they would be programmed that each contraction just causes them to relax more, much more. Each contraction just helps the woman relax so much more, and at the same time we program out of her the word labor and labor pains, and program into her that anybody who uses them, you just feel sorry that they're still stuck in that old mental mindset. So that would be number one. Most women could have their baby just by doing that. Because how many contractions are you going to have before a baby is ready to get born? A whole bunch. So if you've accepted that, the relaxation itself, many, many times all a woman needs. The second one was to teach them a self-hypnosis technique where through a finger pinch or any other trigger, you would have them anesthetize themselves between the base of the breasts and above the knee. So everything in between would be totally anesthetized. That ended up being the most popular because they could walk and talk and do all these things while they were having the contractions, and the baby would be born, and all they would do is feel the pressure but no discomfort whatsoever. They liked that one. The third one, though, is the way a lot of women who had a baby the first time want to have it the second time. They want to be out of there. They don't want to be around the place. They want to be in Cleveland, any place, but in that delivery room. So for these women, the coma state was the perfect approach to having a child, because they would not be part of the process, nor would they care to be part of the process. They would be in this utopic place, whatever that meant for them, running through a field of new cut daisies, or sitting by a beautiful beach watching the sunrise or set, or whatever it is. Sitting on Mount Everest on a warm day. Would that be possible? I don't know. But anyway, the coma state has great value for the childbirth technique. One of the really super everyday uses of the coma state, and I think it's probably one of the best reasons to have people learn how to do it and how to do it themselves. I have never in my life found a better stress reduction technique, flat butt, period. Never. In this stress, in this state, any stress that you had can no longer exist if you wanted it to. It's gone. If, you know, some days I'll come home from work and Bob Brenner has driven me crazy all day, caused me great stress with his crazy ideas he comes up with. Whenever he walks in my office and says, "Jerry, here's what we got to do," my stress levels go up. And I get strange phone calls all day long, and well, stuff happens, especially like when I'm doing it reminds me, the legislative season is just open, so that's going to be stressful again as we get up there and protect ourselves against any sneaky stuff going on. But I'll come home and I'll sit at the kitchen table, for example, and drop into the coma state. And that's kind of fun because my back will be to Shirley, maybe she's made a pot of coffee or something, and she'll be talking to me, and I don't even answer. I'm just like gone, you know, and finally she'll like hit me with a frying pan to get my attention. But that doesn't hurt. You have a natural anesthesia in the coma state. And she gets all frustrated thinking I don't want to talk to her. But that's not true. I've just done a wonderful stress reduction technique, and you spend 5 minutes in this state. And when you emerge from it, you feel newborn. You just feel absolutely fantastic. The other thing is in our ultra height program, we can use somnambulism as the primary launching point, but if you can get it into the person into the coma state, and that's a great launching, that's the best of all launching points for ultra height, where you can leave the body down in this completely relaxed state and move the mind very high up for the healing that's available to it in those higher levels. Another benefit of this state, and I think you physicians will probably agree with me on this, the more a person is able to relax, the more rapid a physical healing will be of an injury. Think what happens when you cut yourself. When you cut yourself or hurt yourself, what happens to the muscles around the injury? They contract, they tense up, and that makes it hurt more. And if it hurt more, what happens to the muscles? They contract even more, and you get this vicious cycle going for you. But if you get a person down in ultra depth and nothing, there's no stress whatsoever, then the area can heal a lot more quickly. somebody throws their back out, or an L5 disc shifts or something on this order, and it has to be put back into place, or should be put back in place. Many times when a person is in ultra depth, it can be manipulated by hands right back into the place, because there's no resistance around the disc. So the disc can move very easily where the doctor will want that disc to go. And it's amazing, you physicians, if you ever worked on a body in this state, it's so palliative, it's so easy to feel what's going on under the skin compared to when they're tense and they're tight and they're hurting. So it's a tremendous state for the physician to use in their practice. When we talk about some of the negatives, there are very few negatives to this state. You really have to dig deep for it. We already said a person's not going to accept suggestions, so it's not a state where you do therapy in. You're wasting your time. There is an exception to this that's been recently discovered. I kind of spent a lot of time this year seeing what we could really do with this particular level of trance. And I was amazed to find out there seems to be, and I don't want to say anything is locked in stone, but it seems to be, when we say a person will not accept suggestion in the coma state, it seems as if a person has a motivation that if they accepted this suggestion, their life would be so dramatically changed for the better that they would have a willingness at that point to accept suggestions in this state. Now, that was my philosophy. I didn't know if it was going to work, so I decided to play with it to see what I could come up with. And I have found, for me, in my experimentation with the work, I have found one thing that people seem to be able to accept suggestions for in the state. And that is if a person is having severe pain, and of course they're not going to have any pain in the coma state, but it seems as if they're in severe pain of a chronic nature, not an accident that's going to heal and go away, but something they're living with day in and day out, or an intractable pain where it's all over. They can't even identify the source sometimes. It seems as if the people will accept the pain control technique suggestions while they're in the coma state. And it really has an effective power to it then. So it's my philosophy based on that, and I've worked with probably 7 people, not a whole bunch, but it's a beginning, and this seems to be a reality. What else would a person really be motivated tremendously for that they may accept the suggestion in this state? I don't know. I don't know. I mean, the motivation has to be, at this point of my knowledge, my wisdom, it has to be tremendous. Now, I don't know about you, but if I was going through my life every day in horrible pain, I think whatever state I'd be in, if somebody would say, if you do this or do that, we're going to be able to have you so you go through your life without any discomfort, I know I would be motivated for this. I absolutely know it. As a matter of fact, I did it. And one thing I had to go through a couple of years ago. So this is an exciting new twist to this now. It's a very exciting new twist to this in my mind, because pain control techniques taught to an individual in the coma state seem to be quantumly more powerful than taught in any other state. So I am real excited about further experimentation in this particular area of the hypnotic coma. But I haven't found anything else yet that was that motivating. Pain is a tremendous motivator to do anything. Any of you ever been in really severe pain? I mean, really bad pain. Yeah. Would you have done anything to be out of it?
Yeah, I passed out.
That's the door to get out, isn't it? Yeah. Would you have given anything? How about your Rolex watch? If I said, I'll teach a technique you never have to have that pain again, would it be worth it?
Sure would be.
You bet.
Who's gangrene, by the way?
Yeah. I mean, I would hock my watch. my wife, my mother-in-law, whatever it took. Anybody can have my mother-in-law. It's okay by me. So if they have a perception of a greater good, it seems to work pretty well. It seems to be an exciting new area to work in. Maybe you guys are going to discover another area where they might do it. But I think what we have to do is just start taking new mental positioning in our work. Just because we have discovered what we've discovered so far doesn't mean we've learned everything we need to know about it. And we've got to keep our mind open. Historically, new ideas and concepts do not come from the gaining of new knowledge, do not come from experimentation, but new ideas and concepts move forward from funeral to funeral. When the old people, who are generally in charge of the hospital, the hypnosis clinic, whatever it may be, are so dogmatic in their philosophies, there's no room for any new idea, well, eventually they're going to die. And maybe a younger person's now going to come in who's going to be a little bit open, more minded, and now we start to move forward. This has been the history of the development of medicine, psychology, hypnosis, everything. Because we all get locked in, this is the way it always has been, therefore it's the way it always will be, and this is the limitations, and there never will be any additional things that can happen. So I just beg all of you that as you move through life, please allow yourself not to fall into that mental trap. Always continue to try something new, and every once in a while you're going to amaze yourself as you trip over something that never could have been done. And I use the quotes around that because you were told it never could be done by the purported experts. So, the coma state is a tremendous state. There's a problem, another problem with it. What's the biggest problem of the coma state? Well, not a big problem. What is a problem that we have with the coma state?
Don't want to come back.
Nobody wants to come back. I mean, they just don't want to do it. You know, in my regular classes, which a lot of you guys went to, you remember years ago, I was the only one who knew in Fort Lauderdale area how to get people out of the coma state. And stage hypnotists would come to town, and some people, like they snap into somnambulism, just snap into coma. A small proportion of them. And so some stage hypnotists would come to town. Now, stage hypnotists, I believe our profession owes a tremendous debt of gratitude for everything it's taught us during the doldrums of our profession, after chloroform was invented and before hypnotherapy became a science. So, but it was a riot. What would happen in the old days? Do you have any idea what happened when somebody went into the coma state, for example, on the stage? Or what this organization, who never even mentions the coma state, how would you get somebody out of the coma state in those days? Well, it was comical. They said, well, here's what you can do. First thing you should do is blow on their eyes. Or clap loudly by their ears while you're shouting, "Wake up!" Doesn't that term grit you, wake up? Ooh. If that doesn't work, get a jar of water, dip your hand in it, and give them the water flick. Flick, flick, flick of ice water. Then maybe, put your back to the audience so they can't see and slap them a little bit. One of my personal favorites. And if that didn't work, just lay them down across a couple of chairs. They will wake up sometime. And they will. I mean, everybody emerges from hypnosis. And I use the term wake up, comically at this point, because we know it's so unprofessional to use that term anymore. I'm sure that absolutely nobody in our hypnosis community is using that. And we all know why. That can foul up a session so quick it's unbelievable. Hypnotized person says, "Wake up, I wasn't asleep, nothing must have worked, I was never in hypnosis." So we don't use that word anymore. But back in those days we did. So I would go down to the bar. They usually called me up, and these were done in the bars in those days. And they'd call me up about 11:30, 12 o'clock. That's about when the stage show was over. And I'd go down there in my jammies, wearing my Mickey Mouse, I had this great pair of Mickey Mouse jammies and Mickey Mouse bathrobe with Pluto and all these things on it. And I'd go into the bar that way, which was kind of fun. And I'd just whisper in the person's ear, and they had emerged from the coma state. And then, of course, part of the deal was I made $50 in those days, which is probably what they were paying a stage hypnotist, plus 2 scotches on the rocks at the bar before I left, you see. And so how do you emerge somebody from coma? What is the one thing they're more frightened of than anything else in the world?
Can't get back there.
Right, you know that they can never get back into the state. So the easiest way, and it'll work every time somebody's in the coma state, you simply say, now I'm going to count from 1 to 5. By the time I reach the count of 5 or before, your eyes will open, you'll become fully alert, and if you don't, I will program you so you can never get back into this state again. And you start to count. And if you use those terminology, those words, I'll guarantee you by the time they hit 3, their eyes fly open and they look at you in terror. You mean you'd never let me back there again? So you don't have to worry about that. Everybody can be emerged from the coma state. A lot of people have a problem, though, in identifying the coma state. One of my really good friends wrote a book called Answer Cancer. Any of you ever read that book? His name's Steve Parkhill. Well, when Steve Parkhill first came to me, he was a worn-out salesman, disgusted with life. And I brought him into the hypnosis class, and he was taking his first hypnosis class with me, and he had never been hypnotized before. And Steve's life was so full of stress, tension, that when he went into hypnosis, it was the most wonderful feeling he had ever felt. And he was in beautiful level of somnambulism, loving every minute of it. So I said, okay, Steve, I demonstrated the technique, whatever it was. Count of 3, eyes open, fully alert. 1, 2, 3, nothing. Some people will think he's in the coma state. Now you don't want to make this mistake. Just because a person does not emerge when you ask them to emerge does not mean they're in the coma state. They may be like Steve, who has never experienced that level of trance before. It felt so good to him, he just didn't want to leave. Now the way you identify whether that's a situation or whether somebody's in coma is you ask them the question, hey, how come you didn't open your eyes when I asked you to? If they talk to you at all, they are not in the coma state. And Steve said, oh, God, this just feels so good. Well, now you know they're not in the coma state. Then you simply use whatever technique you want to. In that case, I said, Steve, you know, we're in a class and you're up in front of the class and, you know, we've got to move on. And then they realize and they get a little embarrassed. Oh, I'm sorry. I said, okay, this time at the count of 3, open your eyes. And 1, 2, 3, boom. And his eyes opened up, and he looked a little sheepish, you see. In your office, when that happens, you can say something like I always like to say, when somebody says, oh, God, this feels so good, I never felt like this before. Say, fine, I want you to know that you can stay and enjoy this state for as long as you want. I mean, I want you to be the most comfortable and just stay here until you just feel so good. By the way, I get $150 an hour for the chair, but take all the time you'd like. And you want to see the eyes boing open so fast? Forget about it. I mean, it's amazing how quickly they come out of that state, you see. So the important thing is, and this is on examinations all over the country, what do you do with a person if they don't open their eyes when you ask them to? What's the problem? And too many people jump in and say, oh, it's the coma state. Maybe, but maybe not. You've got to ask them the question first. Why didn't you open your eyes? If they say anything, they're not in coma. When they're in coma, they don't want to talk to you. When they're in coma, they don't want you in their life. When they're in coma, they want you out of there. You can do them no good. You're a pain in the butt. Like my little daughter used to say, "Leave me alone." And that's what they want. They want to be left alone. So Don't worry about emerging a person from the coma state. So everything's better with coma on it. How do we get to the coma state? What are the steps that we need to get to the coma state? Well, I'm glad you asked. Through all my classes, when we do the coma state, everybody has asked me, because we demonstrate it, as we will today, but everybody says, Jerry, don't you have a handout for those words you say? And I always said, no, just write it down. Well, you write it down, days are over. Yay! My wife threatened me that if I didn't write this down for this class, she would do something dastardly. Like not make me any more chocolate pudding or something, and I'm sure that could have happened. So the first part is achieving the coma state. Let's hand this out and we'll go over it. And you folks that might be watching this on a tape, look in the back of your tape box, it's there. Unless we forgot, put it there, then call the office and we'll get it for you.
Is Shirley coming back so we can order the tape?
I don't know. Okay, let's take a look at it. Now, before we even look at this piece of paper, let's start off with the absolute mandatory requirement for going into the coma state is what do you have right before that? Somnambulism. Do not try to get somebody into the coma state from light or medium hypnosis to coma. It's not gonna happen, period. So we start with somnambulism. And then, basically, here it is all written out for you. You just say to the client, like it says, I'd like to take you to the very basement of relaxation where you feel so good. And you can ad-lib this, where you'll feel so good, you'll feel so fine, you know, where, to a place where all your problems and pains will just disappear. Now, that's true. Their physical pain will disappear, and for many people, maybe even more importantly, their mental pain's going to disappear. A wonderful place. To get to this special place, I'll ask you to go down 3 more levels of relaxation. For lack of a better term, let's just call them level A, B, and C. To get to level A, all you have to do is just double the relaxation you have now. To get to level B, you simply must double the relaxation you have in level A. And to get to level C, the very basement of your ability to relax. I forgot the word today. The very basement I want to put of your ability to relax today, because there is no real basement of somebody's ability to relax only at that moment. So to get to the very basement of relaxation today, you must double the relaxation you have in B. All right, let's begin. I want you to imagine, if you're dealing with a visual person, you might want to say, I want you to see, or you might want to say, I want you to imagine, or see or imagine that you're standing at the top of your own personal escalator. Now remember, if you just say see, there's a whole big percentage of the people out there are non-visual. They cannot make pictures in their mind. It's estimated around 80% of the population are non-visual. So if you say, I want you to see something, and they can't, the party has just come to a screeching halt. So it's always, everybody can imagine, so you can't go wrong with imagine. Simply say, I want you to imagine you're standing at the top of your own personal escalator. In your pre-talk, make sure that you check, make sure escalators are okay. I don't know if I told the story or not. One day a woman came into my office, and I was taking her down to the coma state and did the escalator, and she instantly came out of trance, frightened, scared. And what happened is, it was the first day they opened a mall down in Fort Lauderdale called the Galleria Mall on East Sunrise Boulevard. And there was an Indian woman who was in the mall, and they were wearing all these, I forget what the name of it is, but it's bed sheets. And there was a burr in the escalator. and as it's coming off, the sheet got caught and was dragged under. Well, of course, escalators have safety switches when things like this happen, only the safety switch didn't work. Needless to say, it got to be a rather messy situation. Well, I was so busy, I was working 10 hours a day. Obviously, it was before my heart attack. 10, 12 hours a day, 7 days a week. I had no clue what was going on in the news, and so I ruined that session with her. Had I known that, I certainly wouldn't have used the escalator. So just make sure an escalator is a safe place, or you can have them on a staircase and they walk down the staircase, whatever. You know, you can make your own thing. One time I was dealing with a man. I just happened to ask him in the pre-talk was one of his, I asked him what his most enjoyable experience he can remember as a child. And it was him and his dad were sledding in the snow down this real nice hill. And there were no bumps, and it was so pretty, and he was going down this hill. And for him, I just used, all right, now you're going to get on a sled. It's going to be the same hill, and the sled's not going to go fast, and it's going to be pretty. So I just shot the sled in. So whatever, as long as it's something heading down south, you see. So in this one, I want you to imagine you're standing at the top of your own personal escalator in a moment. Those are always important words. In a moment, I'll count from 1 to 3. At the count of 3, your escalator will begin taking you down to level A, where you have doubled your relaxation. Now, you can make that escalator as long or as short as you want. You can make it go as fast or as slow as you need it to. When you reach level A, simply let me know by saying the letter A out loud. All right, here we go. Now, you want to count on the exhale of breath. 1, 2, 3. And just wait. And in a little bit, your client's going to say, A. Usually like that. A. So you're doing great. Always tell people they're doing good. Feed it back to them. In a moment, I'm going to count from 1 to 3 again. At the count of 3, your escalator will take you from level A to level B, where once more you will have doubled your relaxation. When you reach level B, let me know by trying to say the letter B out loud. If you're following instructions. Now that looks benign, but it's not a benign sentence. It's a very powerful sentence. It's a hypnotic suggestion that they are going to do this. If you are following, a lot of people say my orders. I feel uncomfortable saying that. You may not feel uncomfortable saying that. But I say if you're following my instructions, when you reach level B, your vocal cords may be so relaxed, you may find it extremely difficult to even say the letter B. This is what we want. This means you're doing really well. You know, ad-lib this one a little bit because it's great when they can't. But try to say the letter B anyway. Okay, here we go now. 1, 2, 3. Now, all the way down to level B. And you remain quiet. Now, if the person is the utopic person, will just, you'll see the lips kind of, and that's about it. A lot of people say, B. That's close enough. I don't feel comfortable when they go, B. Duh. I start looking for the exit sign. But most people will do that if they're following the instructions, you see. Now it gets a little different. Tell them you're doing great. Now there's only one more level to go to, level C. The very basement of your ability to relax today. A place you'll feel so good, so fine. A place where all your problems, both physical and mental, will be gone. And all all you have to do is just want it to happen and it'll be there. And it's going to be easy for you. Okay, once more now. Find yourself at the top of your escalator again. Now in a moment, once more, I'm going to count from 1 to 3. At the count of 3, your escalator will take you all the way down to level C. your very basement of your ability to relax today. Now, this is important. Don't try to help. I want to put the words in there that Dave used to use, is that's what defeats us all the time. Don't try to help. Just stay relaxed and let it happen. And I like to pause after that. I should have put some dotty dots in there after. Just stay relaxed and let it happen. And let that sink in for a few seconds. Then, say, okay, here we go. 1, 2, 3. Now it also helps if you're doing the count on the exhale, is if it's okay with the client, you do a gentle press on the shoulder on each exhale too. That's very relaxing for the client. Now you notice on this, we are not asking them to say letter C any place. It says, okay, 1, 2, 3, and then you just start now, all the way down to level C. The very basement of your relaxation. Deeper, deeper, deeper. Letting go, drifting down, deeper, giving into this wonderful feeling of total relaxation. I left that out, you might want to put it in. Deeper and deeper, etc. There's many deepers that are on the paper there. Now, if your client has, in fact, at that point reached the coma state, this is a very good thing. Because now they feel fantastic. But you need to find out if they've, in fact, reached the coma state. And there have been some tests made to find out if the person's in the coma state or not. So we'll do the testing. Now, if for any reason the person doesn't pass the tests, take them down one more level of relaxation, just like you did the last one. All right, you're almost there. Now, I just want you to let yourself relax a little bit more. Let's go down to level D, where you'll have redoubled the relaxation than you have now. And take them down another level, based on that last one, like level C. If they don't get to it then, you're not going to get it in that session. They've bumped into a fear. And what you're going to find the fear is, for a lot of people, there seems to be a quantum difference, a major difference in what they feel as what they perceive to be depth of trance between somnambulism and coma. Some people got about maybe 3/4 of the way to coma, and then they'll report to me, well, I felt that I was on the edge of a precipice, and if I went any deeper, I'd go off the edge and I'd never come back. And so they just need a little bit more time to get there, you see. So they'll maybe work into it the next time you work with them, as their mind absorbs the depth of trance that they were able to achieve in this first state. So take them down one more, and if it doesn't work, it won't work that session. But they'll get there, generally, if they want it and if they follow your instructions. The other reason they won't go there is if they're not following your instructions. And what are your instructions? Don't try to help me. That's the key one. Don't try to help me. If you do, you know, what we're saying to the person is you got to activate your conscious mind to try to help. That means you're reforming your critical factor, that analytical, judgmental part of you, and you've just stopped things. A screeching halt has taken place. So if somebody tries to help, they can't have it. That's the bottom line. So now you think they're in the coma state. It would be nice if they were in the coma state. But we got a test. Now we've not tripped across, but 3 tests for the coma state have evolved. and they need to be given in this order. Would you like a handout on it, or would you rather write it down?
Handout.
I can't hear you. Good old Shirley. What a gal. If you don't make them a handout on this testing, no more chicken soup for you. Have you ever tasted her chicken soup? To die for. Oh well. I know I'll have to edit that out of the tape in case she accidentally hears it. And again, for those of you out there in video world, this will be another handout in the back of your tape box. Would you hold yours up for the camera, please?
That's what's in my head.
She got a blank.
Yeah.
Is that good enough, or would you want one with writing on
You
it?
read my mind.
Okay. There are 3 tests to determine if the client is in the coma state. All tests should be given without mentioning them to the client. Just do them. Now, since we're going to go over the tests here, my victim is going to be aware of them, but that's okay. We'll do something else with that person. Test 1. Since the coma state produces automatic state of anesthesia within, the client tests for anesthesia. A good strong pinch on the wrist or arm is going to be sufficient. You don't have to do what we used to do in the old days. Hold their arm up and ram a hat pin through it. Matter of fact, I haven't seen good old hat pins in years. But if you did, they wouldn't feel anything if they were in the coma state. It wasn't that long ago when stage hypnotists used to do that. Or put a hat pin through the cheeks of their face, you see. It was very interesting visually for the audience. I'm sure it enhanced their desire to enter hypnosis. So the first would be the test for anesthesia. Now, there's a time you don't use this test, or there's a time you shouldn't use this test. If somebody's coming to you for pain control, don't use this test. You don't need it. It's not a good thing. The next one is for a catalepsy. Now, what you do with this one is you put the person's physical body, well, for demonstration purposes, we play with their arms and legs a little bit, where we put them in positions and they should stay there, maybe up like this with their legs sticking out or whatever, and you can actually blow on them and they'll rock in the chair. And they'll stay in that position until they come out of the coma state. This is a great, what good is this? Gee, I could think of, with my mother-in-law I could do this. But maybe if somebody had surgery or something like that and the doctor wanted them to stay in a certain position that they normally wouldn't be in for healing or something, maybe it would have an application there. But for us, it's just one of the mid-tests for coma. When you raise an arm up on a person, for example, can I borrow your arm? You may have to say, not say to the person verbally, but if we want our arm up like this, the subconscious mind doesn't know what we're doing, so we got to give it a signal, maybe like a little jerk. And the subconscious mind eventually will accept that as, oh, that's where I want you to be, and so it'll keep it there, you see. So putting a limb in a position, not yanking their arm out of their socket. I've seen that happen. Well, not literally out of their socket, but I've seen people jerk the arm so hard that it has broken the trance state. And somebody opened their eyes and said, what the devil are you doing to me? So a tender little nudge to the subconscious mind will be more than sufficient. The last one is the one if they pass the second one, you're starting to feel really good about them having the state. But the last one is the most difficult of them all to pass. Now, you got to get into a position where you can see their eyes. A lot of times people in the coma state are all bent over. That means you got to bend over more. get in a position where you can see their eyes. And without any warning at all, after a period of silence, you give a startling command. Something like this. Open your eyes. That scared me saying it that way. Now, if the person is in the coma state, you will see absolutely no response out of their eyes. It won't be, they won't go, they'll just be flat as a doornail. Other than they may have the natural fibrillation that goes along with the hypnotic state. If they have that, you'll see it going into it, but that's not anything. And if that happens when you startling command them, that's normal and not to be concerned with. But if you go, open your eyes, and they go, they're not in the coma state, are they? Because in the coma state, they're not going to listen to you. You are person non grata, gratis, gratuitous, whatever, you know. Then you know you have the state. Then you can go ahead and do all sorts of things with that person. You can do anything to that person you want as long as they perceive it not to be illegal, immoral, or fattening. And some of them are a little wobbly on illegal, but we won't worry about that at this point. In the bottom, in that grayed out box, remember when a client's in the coma state, he's subject to physical capabilities of a non-hypnotized person. You are not dealing with Superman or Superwoman here. Anything dangerous to the average person is just as dangerous to the person in the hypnotic coma. Protect your client. That's critical. Some people try to do weird things with people in the coma state, and the guideline is, would this be hurtful to them in their normal state of awareness? If it is, don't do it. Okay. Any questions on how we enter it or the testing on it? If not, we'll move on to the demonstrational portion after this requested break so that we can take. As you can see, I look a little different. My class forced me to put this on to show that I'm just one of the gang. And so here's the way I'm going to look in a few years when I retire. It's Bike Week here in Daytona Beach area, and this is the way most people look out there today. So, but as you know, most of the bikers are doctors and lawyers, so after Bike Week, they just get back to being normal, as I just did. Is my hair all right? Okay. Well, all right, welcome back from your break. That ought to look great on the tape. And any questions about what we've talked about in the coma state, about the coma state up to this point? We're very clear on everything that we need to know about it. All right. What I would like to do now You'd like to be my victim, sir? Is demonstrate and see if he will allow himself to go into this state. This is David, and I'm sure he'll go into it as well as the rest of us will when we want to. And let's see how we work. Would you like to follow my instructions?
Yes, sir.
You will do everything I ask you?
Hopefully.
Hopefully?
Hopefully.
Say yes or no.
Yes.
You don't want anybody to hope anything. Hope means they're going to fail. So let's see if we can get David on down into the state where he's just going to feel great, and if you want, we'll leave you there for a while.
Okay.
I'll tell you what, if you do exactly what I'll ask you to do, I'll teach you to go there all by yourself. Would that be okay?
Yes.
Okay. So the starting point is somnambulism. Let's go there first. We'll just use a quick element induction to get us into somnambulism. Take a nice long deep breath, fill up your lungs and hold it. Now exhale and close your eyes down. Just let yourself begin to relax very nicely. Now put your awareness on your eyelids, relax them to the point they won't work. When you know you've done that, give them a good test. Make sure they won't work. That's good. Stop testing. And just to talk about this for a second, a lot of people make a mistake here. And they'll say, relax your eyelids to the point they won't work. And now they are relaxed to the point they won't work. Test them and you'll see. You hear what I'm saying? I'm telling him that they're relaxed to the point they won't work. And that's wrong, because if they're not, he's going to open his eyes. So I'd say, relax the eyes to the point that they won't work. When you know you've relaxed them to the point they won't work, then hold on to it and give them a good test. Make sure they won't work. Okay, you're doing great. That relaxation you have in your eyes is the quality of relaxation I'd like you to let yourself have throughout your entire body. So take that same feeling, bring it up to the top of the head and send it down through your body. That's good. Just feel yourself relax more. Now we can deepen this relaxation very quickly. In a moment I'll have you open and close your eyes. When you close your eyes, let this relaxation grow about 10 times deeper. Just want it and it'll be there for you. All right, let your eyes become open. Close your eyes. Now really let go. Feel yourself go much deeper relaxed. Good. Now in a moment I'll have you open and close your eyes again. This time when you close your eyes, just double the relaxation. Let it grow twice as deep. Let your eyes open. Way down. That's good. That's good. Double that relaxation. Let them grow twice as deep. Now in a moment we'll do it one more time, and again this time when you close your eyes, just double that relaxation again. Let your eyes become open. Way down. Now really go. That's fine. You're doing fantastic. You're doing real well. Now if you followed these suggestions for physical relaxation, we have all the physical relaxation we need. But I want to find out if you've been able to do this. So here's what I'm going to do. In a moment I'm going to lift your right hand by the wrist, not very high, just a couple inches. And if you in fact have followed these suggestions, when I lift that hand, that whole hand and arm will feel to me so deeply relaxed. It'll feel as if I'm lifting a soaking wet dish rag, or like a piece of lead or marble or stone. And when I let it plop down to your leg, it'll just drop down, and let it. Don't try to help me lift. You know you can lift that arm anytime you want to, but you know also in order to do that, you must remove the relaxation you're now allowing, and that's not why you're here. Let me do all the lifting. When the hand plops down, just let yourself go much, much deeper. Oh yeah, you got it. Way down. He's got it. He's doing great. You're doing fantastic. Now we have all the physical relaxation we need. I'd like you now to let your mind relax as well as your body. When your mind is relaxed, everything is better, and you can accept suggestions that can help you change any part of your life. It's easy to get mental relaxation, but just like the physical, you have to do it. I can't do it for you. Now here's how we can have the mental relaxation. In a moment I'm going to ask you to slowly begin counting out loud backwards, starting with the number 100. After each number, just simply say the words, deeper, relaxed. You'll count in this manner. 100, deeper, relaxed. 99, deeper, relaxed, and so on. Each time you say a name and a number, double your mental relaxation. Now, David, if you do this, you'll discover that after you say just a couple of numbers, it doesn't take long, you've relaxed your mind so totally, so completely. You've relaxed all the rest of the numbers that would be there right on out, and there just won't be any more. Then you'll have that wonderful mental relaxation feel so good. Start with the idea of wanting that to happen, and watch how quickly you can make it your reality. All right, slowly now begin counting out loud backwards, starting with the number 100, saying the words, deeper, relaxed, and relax them right on out.
100, deeper, deeper.
That's good.
99, deeper, deeper.
That's fine.
98, deeper.
Now let them begin to grow dim and distant.
So,
Now just push them out. Let them go. They'll go if you tell them to. Make them all gone. All gone? Good. Mind relaxed and the body's relaxed, and the mind and body continue to relax much more with every gentle breath you exhale. Not because I say so, it's just the nature of the human mind to enjoy these deeper levels. But I'd like you to relax even more. And just relax while I talk to the group here. Just let yourself stay comfortable. What I like to do after the induction is, instead of blithering a little bit, let's use a little deepening technique just to bring them down to a simple deepening technique before we go into the 3 levels. Makes it work a lot better. David, I'd like you to relax even more. So this time I will count, and I'll count from 10 down to 1. With each number I say, let your mind and body relax much more together, like a team. So by the time I reach the count of 1, mentally, physically, you'll have let yourself drift much deeper. Just want it and it'll come in for you. All right? 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Letting go, drifting down into this very pleasant state of mental and physical relaxation. That's good. I put my mic up for you on the video because it's bike week and a big Harley went by. We wanted to catch the sound, you see. You're doing fine. Now, David, you're doing so well. I'd like to do something awful nice for you today. I'd like to take you down to your very basement of your ability to relax. To a level of hypnosis where you just feel so good, so fine. All discomfort of a physical and mental nature just dissolve, just disappear. It's a wonderful place. And it's very easy for you to get there. Now here's how we can go down to your very basement of relaxation. I would like you simply to allow yourself to go down 3 more levels of relaxation. For lack of a better name, why don't we just call them level A, level B, and level C? Now the trick to getting there, the secret to getting down to these levels is simply this. First, when I tell you to, I'd like you to leave from where you are to go to level A. And to get to level A, all you have to do is double the relaxation that you have now. Then we'll go from level A to level B. To get to level B, all you have to do is double the relaxation you have in level A. And then to get to level C, the very basement of relaxation today, all you have to do is double the relaxation that you have in level B. And when you reach your level of your basement of relaxation, you'll know it. You'll know it because it just feels so good. All right, now let's use your imagination. In your mind, I want you to imagine that you're on the top of your own special escalator. Just like might be in a mall someplace, only it's your private one. In a moment, I'll count from 1 to 3 and tap you on the hand like this. When I tap you on the hand, your escalator will begin taking you down from where you are now to level A. where you will have doubled the relaxation you have right now. When you reach level A, just simply let me know by saying the letter A out loud. All right, here we go. 1, 2, 3, all the way down to level A. Good, wonderful. You're doing really, really well. Now, in a moment, we'll leave level A and we'll travel down to level B. To get to level B, all you have to do is double the relaxation that you have right now. And you know, the more you go into relaxation, the easier it is to double. All right. Once more, find yourself on the top of that escalator. Once more, in a moment, I'll count from 1 to 3 and tap you on your hand. And your escalator will be taking you all the way down to level B. Now, when you get to level B, I want you to let me know by trying to say the letter B out loud. If you're following instructions, you may find it extremely difficult to say the letter B because your vocal cords are so relaxed, but try anyway. All right, here we go now. 1, 2, 3, all the way down to level B. Good. Now there's only one more level of relaxation I'd like to see if you let yourself go to. Level C. The very basement of your ability to relax today. You're going to feel so good. All you have to do to get to this level is to double the relaxation you have now. Just want it, and it'll be there for you. So once more, find you at the top of your own private escalator. At the count of 3, it's going to take you down to the very basement of your ability to relax. Here we go now. 1, 2, 3. Here we go. All the way down to level B. Deeper, 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 down, 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 deeper, 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 deeper. As every breath continues to help you relax even more. Comfortable. Peaceful, deeper. It's fine. Now, giving off physical indications to me that he looks very much as if he's where we want him to be. Now comes that other part, that the second half of how we find out if he's there or not, you see. That's good. I always get an itchy nose when I do this. Pretty nice state, you see. Cool. That's 2 out of 3. And open your eyes. It's called the Cleveland Complex. I'm renaming it. Now, he's got the state perfectly. It's a great state. He's certainly, I'm willing to bet, wish that I would shut up and just leave him alone. So he is in that wonderful state in which any stress he had is gone. He's in a place that's his own. He's not listening to me. And I can talk to you like this, and it's not bothering him. I'm not talking to him. He could care less about any noise I'm making to you folks as long as I'm not bothering him. And it's a great state. The anesthesia is perfect. It's everything you could want out of the coma state. So I think we're in good shape with him. I made him a promise that if he'd allow himself to go into the state, that I'd teach him how to go into it by himself. But if I give him instructions and try to do it now, of course he's not going to listen to me. But remember, the motivational factor. If people are motivated to learn something, why, they're going to do it, you see. Any questions about, while he's in this state, anybody want to come up and do anything to him? Now's your shot. He don't care. I mean, you want to whomp on him a little bit, or rip off an ear or something. He don't care what it is.
Can we work on his mental state
No.
now?
Can't work on anything right now unless he's motivated for it. I mean, really, really motivated for
How
it.
would you know?
Well, I'd know by the pre-talk. I'd know what his problems were, you know. And he doesn't have anything that I'm aware of that's so motivating he's going to pay any attention to me, you see. He's what? He's worthless? I wouldn't say that. He's making a great demo unit here.
Good dummy.
Use them for car crashes, you know, when we replace the dummies in there. That's a good idea. Anybody any questions you want to talk about while we're here before we teach them this specialized technique? Okay. Now, this is a good thing to teach your people because it's such a wonderful gift you can give to people. When we talk about teaching self-hypnosis, well, this is a form of self-hypnosis we're going to teach him, but it's not your normal self-hypnosis because this is not a self-hypnosis technique that's good for anything other than the pure enjoyment of being in this state. It's not a technique of self-hypnosis we use for behavioral change, for stop smoking, phobia elimination. Of course, it is a great one if he wanted to go in and, well, he's not pregnant, so we can't use it for that. But if he wanted from minor surgery in the doctor's office, he could certainly use this particular state, and it'd be great. I remember I used to use this state a lot when I'd go to my doctor, who was a surgeon, he was a surgeon down in Fort Lauderdale. And one day I went to him and I said, look, I got these 2 lumps on my back. I want you to cut them off. He let me look at those. He says, well, they're sebaceous cysts. So I said, oh, whatever. I said, cut them out. He goes, well, I can't do that. We got to be in the hospital. I said, wait a minute. The sign says you're a surgeon. Are you a surgeon? He goes, yeah. Well, I said, why can't you lay me on a table and just whack these things out of there? And he said, okay. So we went in the back room, and actually the next day, well, his brother was there. He was a surgeon too. And I laid down on my belly, and they put all these towels over me, or sterile papers, or whatever they do. And they were getting ready to give me the anesthesia. I said, no, come on, guys, let's just do it. And they were scared to death, but they cut out the sebaceous cysts. I didn't feel a thing. In this state, I had a double hernia operation. No problem whatsoever. A great state. So if anybody wants to do any surgery on him, we could probably dig up a few knives or something if you want to practice. Any student surgeons? No? Okay. Now let's see if we can get him up so we can teach him how to get into this state by himself. David, I'm talking to you. I know you'd rather not listen to me, but I made you a promise, so as long as I make somebody a promise, I'm going to keep my promise. I promised you that I would teach you how to go into this state all by yourself. So, I'm going to keep that promise. But in order for me to keep that promise, I need you to come up one more level. In other words, I want you to come up just enough so you're able to talk to me. Just enough so you're able to speak to me. And if you do, I will teach you how to go back down into this state all by yourself just instantly, very quickly. So as I count from 1 to 3, I want you to come up just a little bit so you're able to talk to me. And of course, if you don't, I won't be able to teach you the technique that I promised you. So here we go now. Just come up enough that you can talk to me. 1, 2, 3. There we go. How you feeling? Good. Okay, he's come up to somnambulism. Now, that was a pretty nice state down there, wasn't it? Yeah. Now, would you like to learn how to go back there all by yourself?
Yes.
Yes. Here's what we're going to do. First, let me teach you the first stages of it here, and then I'll teach you the way to do it all by yourself. Whenever you want to go into this state, whenever you want to go into this state, you're simply going to say to yourself, mentally, I'm going into the coma state. You'll raise this finger and drop it. As soon as it touches, you're going to go right back down into that state. Now, because we don't want you to go into that state for so long that it may foul up your day if you have appointments or something like that. So you're going to tell yourself, I'm now going into the coma state for, and you're going to give yourself a time limit. So for practice, let's just say I'm going into the coma state for 30 seconds. So you'll say to yourself, I'm going into the coma state for 30 seconds, raise this finger, drop it, and you're going to go right back down into that state. At the end of 30 seconds, you're going to come right back up to where you are now, no higher, and you're just going to say to me, I'm back. Do you understand? All right. So now tell yourself you're going into the coma state for 30 seconds. Raise your finger, drop it, go right back down where you were. And while he's there, I'm going to make sure because I'm going to test him. No problemo. So he's back to where he's enjoying himself and having a good time. Good, he's back. That was about 45 seconds, but considering the level he's at, that was pretty close. All right, now we're going to do that one more time. You're going to go back there for another 30 seconds. So when I tell you to, just say you're going back into that state for 30 seconds, raise the finger and drop it. Now, when it comes to accuracy of time, let me explain to you something. If you're thinking about the time, it'll always be wrong. If you just don't worry about the time at all, your subconscious mind is a better alarm clock than you can ever be. You'll be right on the money. So don't even worry about the time. Don't think about it. Your subconscious will do it beautifully. Tell yourself, I'm going into I'm going into the coma state for 30 seconds. Raise your finger, drop it, go back into that state, and then say, I'm back when you're back. Cool, huh? Good. Just let yourself relax. You're doing fantastic. Now here's what we're going to do. This is going to be really easy for you to do. In a moment, I'm going to emerge you completely from hypnosis. Then using that same technique, you'll say to yourself, I'm going right back down into the coma state for 30 seconds. You'll raise a finger, drop it. You'll close your eyes. You're going to go right back down into that beautiful state. And at the end of 30 seconds, you will completely emerge yourself. Your eyes will open. You'll become fully alert. Now, I want you to open you. I want you to come back so you can have this technique. Obviously, when you're doing it by yourself, you can put any time limit on you want. 5 minutes, 10 minutes, an hour, whatever. But for practice, at the end of 30 seconds, I want you to completely emerge. Do you understand those instructions? All right. At the count of 3, your eyes are going to open. You're going to become fully alert. You're going to feel great. You're going to be very excited about the concept of going back into that beautiful state where you feel so good. One, slowly, easily, and gently feel yourself coming back up to your full awareness. At the count of 2, you're still relaxed and calm, but a wonderful feeling of energy begins to flow into your mind and body. You feel good. On the next count, let those eyes open, fully alert, and feel fantastic. Get ready now. All right, number 3, open the eyes and feel good. How do you feel?
Completely relaxed.
All right. Get in a nice, comfortable position. Silently tell yourself, I'm going down into that deep state of coma for 30 seconds. When you've done that, raise the finger, drop it, go into the state. I'll hold your body. You won't go anyplace, so really let yourself go right back down there. All right, when you're ready, give yourself the time limit and drop right back in. Anybody in here jealous? Raise your left hand. And my wife is talking to me in this state. Do you think I'm paying any attention? Really good. That was, how you feeling? Huh? Now, how's it feel when you're down there?
Weightlessness, you know, just completely free of any, you know, worries, problems, you know, you just...
You like it there?
I love it there.
Do you like me talking to you when you're there?
Don't pay any attention.
Like my wife. Feel good about knowing how to go there by yourself?
Definitely.
All right. Now, let me ask you a question. While you're up here, is there anything significant about yourself that you would like to have feel better or be improved in any way?
Oh,
You're already good looking, that's not a problem. You're definitely a ladies
might
killer.
do. Yeah. Weight, maybe?
Gaining or losing?
Losing.
Well, you don't know, Jim.
I'm just
He
a,
may be studying for a part in a movie.
I'm just a foot short for my weight, that's all. So if you can give
You
me
want to gain a foot?
Gain a foot, yeah.
Watch this. I'm going to show you a neat little spin-off on this.
Open my mouth or get in trouble.
Well, you want to lose the weight, don't you?
Yeah, definitely.
Okay. All right. You really want to lose it bad?
Yes.
I mean, no, you're not fooling around. You're not just saying, well, I'd like to lose it, but, you know,
No, I'd like to.
you really want it to
I really
go.
want it to go.
All right. I want you to drop back into the coma state without a time limit.
Okay.
And then I'll take over from there. You got the idea?
Got it.
I really want you to let yourself go even more than ever before. So I want you to get your body in as physically a comfortable position as you can. What a ham this guy is. Okay, when you're ready, tell him going into the deep state of coma hypnosis, raise the finger, drop it, and I mean let it all hang out.
Okay, I'm going into a deep state of coma hypnosis.
A good thing to check on your people, you notice I have my hand on the back of their neck. The neck muscles are the very last to relax and the very first to tighten up. And his muscles are just like loose rubber bands. It's always just another indicator in the game that we look for, and he's doing fine. Now remember, and I just want to try something here. I don't know if this is going to work or not. I'll be honest with you. But I want to try something, because he said he really, really wanted to lose the weight, remember? Let's find out how really, really he really wants to lose the weight. David, I know you don't want to listen to me necessarily, but you want to lose the weight that you consider to be excess baggage for you. You want to look trim and feel good. I can help you to do that. But you're going to have to do something for me, and I know in this state that's something reluctant in your mind. But I want you to think how good you're going to look if this weight is off of you. It's going to be everything you wanted, and you're going to be able to maintain that trim, tight, firm, athletic body you desire. So here's what we're going to do. I'm going to count from 1 up to 10. With each number I count, the physical part of you is going to grow much more relaxed. Your mind, on the other hand, is going to begin to rise very high, extremely high, to a very special place. To a very special place, way above the area of higher self, to a place where you will have amazing capabilities that I'll tell you what they are when you're there. Just let this happen now, and the weight problem for you very quickly will be part of history, of your personal history, not to come back again. Don't worry about feeling anything different than you are now. Don't worry about losing the mental feelings of pleasure, because that will only become enhanced as your mind grows higher and higher. What you feel in your mind of peace and tranquility is nothing compared to how beautiful, how peaceful you will feel when you reach those mental heights that I want you to. But the body will grow much, much more relaxed. Jim, would you come around behind me and hold him by each shoulder so I don't have to use all my time holding him up here? That's great. Thank you. All right, here we go. With each number, your body even goes much more relaxed. Your body is something you care nothing about. It's not important to you now, and that's the way it should be. Your mind is the part of you now, which is going to be the healing, transformational part. So if you really want this, watch it happen. Let's begin. 1, now you're moving up. As your body gets heavier and you don't care about it very much at all, it's not important. 2 and 3, and your mind lifts higher. You feel lighter, you feel freer, you feel more alive than you ever knew before. 4 and 5, higher as complete pleasure flows through every part of your mind. 6, much higher now. 7, to a wonderful place where you're going to have wonderful abilities. 8, higher now. 9, we're almost up to that place. Just feel your mind grow clear yet powerful. 9, higher to a clearer, higher level. 10, up to that very special place where you can see clearly now, where everything is a pleasure. You feel comfortable. You feel at home. You're easily able to communicate with me. Now, I want you for a moment just to enjoy this special place. Feels good, doesn't it? You can communicate with me here. Feels good, doesn't it? Now, this is a very special and unique place for you to be. You have been carrying around some excess weight. Well, I've never had that problem, but I can understand where some people have had the problem. But in this place that you're in now, you're going to be able to get awareness about this. So much of an awareness that you will be able to discover exactly what you need to do to correct this problem without any effort or suggestions by me. So now we're even going to move up to that higher level, one more level. When I reach the count of 5, will be a higher level than we are now, where you're going to have access to the knowledge of what's causing the weight, what you need to do, correct it, and you will be able to correct it right here, right now. Let's move up one more. 1, now your mind moves higher and higher. 2, higher and higher. 3, 4, way up now. 5, light, free, aware. Now I'm going to give you a moment of silence. During this period, you will discover why you've carried this excess weight. You're also going to discover whatever it is you need to do to correct that. When you have an answer, and I don't care what it is, I just want to know you have the answer. When you have the answer, you'll raise this finger to let me know. All right, I'm going to give you a period of silence. You're going to discover why the weight is there, and you're going to discover what you need to do to correct that problem for the rest of your life during the period of silence that begins now. So now we just wait. Big boy. Push him over that way. That's good. We can chat. Well, he's already discovered. Now, have you gone inside yourself and discovered the reason why you have this weight, this excess weight?
Yeah.
Have you discovered what you need to do to correct it? Can you do the bulk of that work here and now? All right. I'm going to give you another period of silence. During that period of silence, you will do whatever you need to do that will put you on the road to a steady, healthy loss of that excess weight. When you have completed your task, once more raise this finger to let me know during the period of silence that begins right now. This is what's beautiful about this technique. We really don't have to do very much. And nobody knows how to correct better than the person that has the problem. Sometimes we fall into a case of abject pomposity where we think, pomposity? You know what I mean. Where we think we have all the answers. Well, the answer is here. Have you done what you needed to do? Good. Well, it's none of our business what you did or what you discovered. So now, as I count from 5 down to 1, your mind will go right back down into that deep coma state with your body, and you'll be much deeper, knowing you're on that way to change completely. 5, 4, 3, 2, 1. That was pretty good. I think he's discovered something. And usually people, when they're up working in this level of ultra height, up in that level, have a memory, and if they want to share it, they share it, and if they don't want to share it, they don't. And you should never push them, because sometimes they're dealing with things that are extremely personal, and that in fact are none of our business. And we're not going to be that presumptuous to interfere. On the other hand, if they want to talk about it, well, we're here to talk about it. And again, if he's gone down into that level, again, we can go ahead and he'll sue me tomorrow. I'll skip town and be out of here. Okay. Now listen carefully to me, and I know you don't want to, but in a moment I'm going to count from 1 to 5. At the count of 5 or before, your eyes will open, you're going to become fully alert. And if you don't, I'll not only program you so you can't go back in this state, I'll take away your self-hypnosis that enables you to get there by yourself. So at the count of 5 or before, eyes open and feel great. 1, 2, 3, 4, 5. Open your eyes and feel great. How do you feel?
Wonderful. Great.
Oh, I'm excited about that.
Yeah,
you did
thank you very
super.
much, Ray.
Did you discover anything about yourself that made sense?
Not right at the moment.
Do you remember when we went up to the upper height, to the upper level?
Yeah.
Did you do a good job there?
Hopefully.
Pardon me?
I will. I did. Yes.
Did you find out any, I don't want you to tell us, but did you find out anything interesting up there?
Nothing was home.
Nothing?
Everything was out to lunch.
Everything?
No, I think I did.
All right.
Seriously.
Okay, go away. Give him a hand for being up here. What a ham. If tomorrow when you wake up you notice anything about one of your arms, she did it.
Bless your little hand.
There's your coma state. It's not a difficult state to get into. He loves it. He loves hypnosis. For the person who loves hypnosis, anybody can go there. Orville, you ever been there? I would picture you to be the perfect one to be there. It's a great state. For you doctors in your offices, imagine what you could do with people when you drop them in the coma if you had to do some physical work on them. Of course, it's not a good spot to give them instructions on how to take medicine or anything like that, but if you've got to do a little minor surgery or physical manipulation. What kind of doctor are you guys?
No, I'm a lawyer, but she's a physical therapist.
A who?
She's a physical therapist.
Physical therapy. You're a lawyer?
Yeah.
Oh my God. Now I find out there's a lawyer in the class.
Leave me a card.
My brother's a lawyer, so I come from a legal family. They were always trying to lock me up. So, okay, that's Tacoma. It's a great state. Would you agree?
Yeah, it's a wonderful state.
Yes, and look at the peaceful tranquility look on his face.
It's just being done.
Yeah,
No, it's wonderful. It's great.
it is. It's
Excellent
super.
feeling.
Now, the important thing is we are now beginning to learn, like we said earlier, that Tacoma State is not just necessarily a state in which nothing can be done, which is what we have basically considered it to be up to this point. Well, we already have found out that if there's a high degree of motivation, if a first person's perception of doing something in the coma state will give him greater benefit than what he's already experiencing in the coma state, it seems they'll have a tendency to follow instructions and to learn that. Right now, like I said, the only thing that I'm sure of is a severe pain or an intractable pain type of person. Maybe there's some other things. You guys let me know when you go out and start working with this, because I will learn from you. The student becomes the teacher, and I encourage that. I will attend your classes shortly where you're going to teach me what you've discovered, and I'll look forward to that. Don't be afraid of this. There is nothing to be afraid of. There is no harm that can come to somebody in the coma state unless you create the harm. And you can create harm if you do something ridiculous to a person in that state. Remember, anything dangerous to a person in a normal state of awareness is dangerous to him in a coma state or in any other state. So we always use common, prudent sense in working in the area. Questions? I can't be that good of a teacher. There has to be questions. No, huh? Anybody here think they can't help somebody get into the coma state? Of course not. Anybody in here going to make their people go into coma state?
Yeah.
Nope. Anybody here going to see if they can help their people go into the coma state? Sure. You're not going to make people do anything they don't want to do. But I'll guarantee you the gift that we gave to him is a wonderful gift that if you can give to some friends of yours or to your patients or to whomever, they will be eternally grateful because of the benefit it gives them. You teach somebody, for example, who is in a hospice and they're having terrible pain, and you teach them how they can go into the coma state all by themselves, they will love you forever. There's a variation of that self-hypnosis technique where they can go into the coma state and then open their eyes. It's a little bit of an advanced technique. So you can get the people into the coma state with these cases of intractable pain or cancer, bone cancer pain, things on that order. Just picture the most excruciating pain that a person can feel. Anybody got any idea what some of the most excruciating pain would be?
Burns.
On the top of the list, burns. And somebody who knew your technique could instantly move away from that and wouldn't be part of that process anymore. Burns are a horrible pain. Bone cancer is a terrible, terrible pain. And this state takes all of that away. So as you work with your people, enjoy that. Give them this wonderful gift, because it's a gift to be given. And hopefully you'll have that caring nature to do that for the folks that you work with. I know every time I train somebody in this state, I feel so good. I feel so good because I know they have something that is usable, practical, and can become part of their everyday life in a lot of different ways, even if it's just for stress control. So I'm excited about you working in this area. And I want to hear some great stuff on what you've been able to do. You're going to do it, aren't you?
Yeah.
Who's not going to do it? Good, because if you don't, we got Guido and Dominic in the other room. They're going to talk to you on the way out of here. All right, any questions before we shut down the tape? Yeah.
There obviously are limitations on the way you should use this
without a doctor's approval, or when you need a doctor's
Yeah, if you're working on a medical problem, you need a doctor's approval. You don't need a doctor's approval if you're just teaching the coma state for stress reduction, things on that order. You know, just general relaxation, stress reduction. Sure, if you're going to use it for pain control, you better have a referral. This is, you know, anytime you're working with a medical problem, you must be working under referral from a physician. You do not cut corners here. That is not what we do in the work. I say that over and over again in every class. If it's a psychological problem, you get an approval of a psychologist or a psychiatrist. We are not doctors. Therefore, we should not act like doctors. We are hypnotherapists. We can do wonderful things. And as long as we have referrals, we can do magnificent things. So I want you to go forward and do the best you can. All right, we're going to end this tape now. And I hope you've enjoyed this. And I'm sure that you're going to go ahead and use this, and I'm going to be excited about it. Thanks for being here, and we'll see you then.